So the next thing I'm going to talk about is position of ease for a patient with piriformis syndrome. If you have piriformis syndrome, your muscle that attaches from the sacrum to from your back to your leg could be a little bit angry and contracted, so you want to try to relax that. What you want to do is lay down on the floor in front of a chair, set both of your legs on the chair, and allow your knees to kind of fall out. This will allow the muscle, the piriformis muscle, to relax. So I'm going to be talking about how to stretch out your piriformis if you have piriformis syndrome. If you have the pain on the right side of your bottom, what you're going to do is lay down flat on the floor and put both knees in the air. And if it's your right leg or your right bottom that's hurting, you'll cross over that right leg. Use your hands to grab the back of your left knee and pull. The stretch should be right in this area, which is right around where I'm actually feeling it. If you are unable to do that, the next thing that you can do is try to bring this knee to your left shoulder, the opposite shoulder. You don't get quite as good of a stretch, but you have to do what you can to stretch out the piriformis. Hello, so now we're going to be talking about how to stretch out your piriformis from a sitting position if you have piriformis syndrome. We'll be using an example of where I have piriformis syndrome on my right, so my right bottom is painful. What you do is you'll grab this right leg, set it at the top of your left knee, and then you will lean forward. You should feel the stretch right in that right gluteal muscle, your right bottom. Now I'm going to be talking about how to do a low back stretch if you're having a tight musculature in the lumbar region or the low back. So what you're going to do is you're going to lay down on the floor, and then you are going to take your one leg, cross it over, trying to keep your shoulders on the floor and letting that leg kind of just sink to the floor. Sometimes you'll hear a pop. It's completely normal. Hold this for about 20 seconds. After you're done, you can return back to neutral. And you can do it on both sides.